Okay, hi. Thank you for joining the press conference. It's December 2022. Obviously, from the health department, we want to wish you happy holidays and hopefully some joyous times in the next few weeks as we enter into the new year. We wanted to do this conference to just bring you up to date on what we're seeing in the community. As you know, COVID continues to be classified as high transmission, high community transmission by the CDC. This is based on the number of cases we are seeing, which are over 200, and the number of hospitalizations that are occurring in the community. We've seen an ongoing uptick in the percentage of hospital beds that are occupied by patients who have been admitted with COVID, and that is now approximately at 9 to 10% of the hospital beds. We also have two other respiratory illnesses going on. One is RSV, affecting primarily children. As you know, there's no vaccine available for this. We are hoping that we may have seen the tip here, and we will start seeing a decrease in the number of cases. That is what is occurring nationally, and we believe that our data will follow that, and we're very hopeful for that because of the impact that it's had on children and on our pediatric hospital beds. Finally, we need to talk about flu. As you know, we're 8 to 9 to 10 times higher than we would normally be at this time of year. And we are overall at a higher level of flu in terms of the number of cases we would normally see. So we've shifted the curve to be an earlier season with a more intense number of cases, so a higher number of people being affected. Let me talk briefly about what we call mitigation for all these. As you know, vaccines are available and remain available for COVID as well as flu. You can get them simultaneously at the same time. The bivalent booster is available. At this point, approximately 40% of our population over 65 has received the bivalent booster. The reason why that's important is that is the category stratified by age that is most at risk for significant morbidity and death. Morbidity will result in hospitalization if you get seriously ill and you are over 65. So we strongly encourage people to get the vaccine. At the same time, influenza has a vaccine, as I talked about. So we would really recommend, once again, that the age group, the age stratification reveals that people that are older are more at risk for significant hospitalization and death if they get the flu. So it behooves us, and we encourage people in that category to get the vaccine. Overall, we encourage everyone that's eligible to get the vaccine. In terms of COVID, the 6 month to 5 year bivalent booster has been approved. That is not yet available in our clinics, the public health clinics scattered throughout the county, but we do anticipate that we will have that early next week. That information will be available on the website. And finally, I want to talk about the few other things you can do. We've said these repeatedly. If you're ill, please consider staying home. We know that that can affect hourly wage earners, and we want to be sensitive to that. But if at all possible, please stay home. In addition, we have recommended that you mask in indoor social situations. We went out with a public health advisory earlier this month. We still recommend that you mask in social situations. And with that, I think I will just take some questions. Thanks.
Okay, we'll get going on the questions. Right now we have two queued up. We can start with Bud Foster.
Good morning, Dr. Cullen, and happy holidays to you as well. 'Tis the season for office parties and holiday gatherings. We all know that. Adelita Grijalva had one scheduled for tomorrow to celebrate her 20 years in TUSD, but she canceled it because of, and she said explicitly, because of the spread of COVID. What would you recommend for office parties, holiday gatherings, and those kinds of things this time of year?
Yeah, I think it's important to remember that what we're seeing are respiratory diseases right now, and that means they're spread through the air, spread by breathing and coughing and what we call respiratory droplets. So it's important to consider where and how an office party or a holiday gathering occurs. As we have stated in the past, if these can occur outside, and I realize it's a little cold right now, that would be best. In terms of large indoor gatherings in social situations that are not your family members, so you don't know whether the individuals are at risk or whether they've been vaccinated and or protected from both COVID and the flu, we would recommend that there be limited availability of these social events indoors. Hopefully that helps, but.
Okay, next is Raina from Kagan. Raina, if you can pronounce your last name for me, because I haven't come across that before.
Preciado.
Thanks.
No problem, and thank you, Dr. Cullen, for taking your time to answer our questions today. I have two questions. The first one being, are you able to speak to the shortage of children's medicine? And if so, can you also talk about some healthy alternatives if people come across this problem?
Yeah, we do. Thank you for that question. We do track the shortage of medications. We track that through the state, and we work with the state to have insight into availability. There is little at the county level that we are able to do to ensure access to medications when there has been a national shortage. In terms of replacement medications, we do know, for instance, that if one antibiotic is unavailable, in most cases for children, there may be another antibiotic that can be substituted. For further information, we would recommend that you follow up with your primary care provider if you're in a situation where you can't access that. The one thing I do want to talk about briefly is Tamiflu. Tamiflu does appear to have a national shortage. The federal government is working with the Strategic National Stockpile to see whether there can be a release of Tamiflu through the Federal Distribution Center. That would then mean that Tamiflu would come to the state and would come to the county for further distribution. Remember, Tamiflu is a prescription medicine. If that does occur, we will be working with the healthcare systems to make sure that we have equitable and adequate distribution of that medication if and when that occurs. Thanks.
Thank you, Dr. Cullen. And then my second question, do you have any information as far as a health impact or any issues regarding sanitation for the main water break that's going on right now on Speedway and Cole?
Yeah, you know, Raina, I have no information on that, so I can't comment.
Okay, thank you.
Thanks. Next, we'll go to Benito Kelty. After that, will be Patty Mackler.
Thanks for taking our questions.
Benito, you're breaking up. I don't know if Anthony can hear you.
I couldn't. Benito, you want to try again? Right now, you're muted.
Hello?
I did hear hello.
All right. We can try to come back to Benito. Patty, if you're ready, then we might go to Bud Foster after that.
Yes, thank you. Thank you, Dr. Cullen, for your time this morning. Can you give us a little bit more information about how things are going at our local hospitals and advice for the public in terms of, you know, going to emergency rooms versus urgent cares and things like that?
Yes, we do, as you know, monitor the hospital bed situation as well as the ED capacity situation. Approximately a week ago, the pediatric bed situation was quite limited. Bed availability was quite limited in Pima County. That seems to have lifted a little lately. The inpatient adult bed situation reveals that there is very high utilization. Remember, we look at bed availability and bed utilization. These are all dependent upon staffing. So a hospital could have 100 beds, but only have adequate staffing for, say, 80 of those beds. So what we look is the availability of the staffed beds. At the current time, the hospitals are running a high census. That means a high number of patients are currently in the hospital. Our recommendation from the Public Health Department would be, first, if you have a primary care physician, please talk with them before you seek urgent care. In a case of an emergency, please still go to the emergency if you're having chest pain, severe shortness of breath, any other symptoms for any other diseases that would normally require an emergency care visit. Please make sure you seek that care out. At the same time, I would remind people that scattered throughout Pima County are multiple other access points for care, including urgent cares. They are appropriate to use in cases where you believe that it is not an emergency. So for instance, you have a cough and you have a fever, but you're not short of breath, but your cough has been persistent and now you're worried. In that situation, we would recommend you call your primary and/or seek care at an urgent care center. So Patty, hopefully that explains it. We are very aware that we are entering the highest capacity in our hospital beds for a normal year as we go into December and January. So we are concerned, but we are working with the hospitals to make sure that we have insight into what's going on and that people seek appropriate care. If you need emergency care, go to the emergency room. If you think you need urgent care and/or primary care, please seek out an appropriate care institution to receive that care. Thanks.
Thank you.
Hey, Benito, do you want to try again?
Hear me?
Somewhat.
Hello?
Okay, that sounded good. Go
Yeah,
ahead.
that sounded good, Benito.
Okay. Okay, great. I was going to ask about RSV and how it's children. If you go about that, just what we're treating here in the county.
I kind of missed that. I don't know if you caught it. Benito, if you're okay, if you want to drop that question in the chat, we can ask it that way.
Yeah, it's also in chat.
For now, let's go to Bud Foster, and then we'll get to some questions in the chat.
Yeah, Dr. Cullen, I'd like to follow up on the office parties and holiday gatherings just a little bit, if we might. I realize there are going to be a lot of them this year. What about suggestions on masking for those, or how about even suggestion about canceling some of those because of the high rate of transmission in COVID right now?
Yeah, this is a great question. Should you have office parties that are inside with a large group of people? We would probably recommend you not do that. If you elect to do that, there are things you can do to mitigate. One of the problems with office parties is they usually involve food, but ideally, masking can help mitigate spread of multiple diseases. You can also ensure that there is more space. So you will recall that there are some recommendations about space, which is if you put people into a dense space, you're more likely to have transmission of disease. So if you can have an office party and when you look at the square footage available, each person has 100 square feet, you're probably okay, especially if you mask. But overall, the recommendation right now would be to minimize social exposures indoors where they are not family members and known vaccine status for individuals. So, but hopefully I can make that really clear. The Public Health Department would recommend that indoor office parties be very limited this year. And if there is an indoor office party, we would recommend that you consider masking. Does that help?
That's great. Thank you very much.
Thanks.
Okay, right now we do have at least one question in the chat. Also one more with hand up to ask a question, and that is Coris Nylander from KBOA.
Yeah, are you calling on me?
Yeah, of course we are.
Thank you. Yeah, my question is whether you're vaccinated and have a booster shot, or completely unvaccinated. If you get COVID, you recover. Do you have any information and data on a period of time of which you would expect to have an increased natural immunity after being sick, where you could expect to not catch COVID again for a period of time? Or is that not a thing with this virus?
No, this is a great question. I would tell you, I think we're still learning, but the recent guidance for the booster is that if you've had COVID, so you haven't had a proven laboratory confirmed case of COVID, that it is okay to wait at least 8 weeks before you get your booster. So the belief is that 8 weeks is what you are referring to as immunity that has been caused by the disease. The caveat to all this is that immunity is to the variant of COVID that you got. Remember, we've had multiple variants. But right now, our recommendation would be is if you've had COVID, you could wait up to 8 weeks to get your booster. You could also get your booster as soon as your symptoms resolve. But there is this 8-week period where we believe there is immunity that develops in individuals because of the infection itself.
Thank you so much for your time.
Thanks.
Okay, we do have a question from the chat. Barbara Villa from Arizona News Radio. With flu having peaked earlier than usual this season, could this mean it could also wind down earlier than usual?
So flu has peaked early. It's kind of peaked with a vengeance. Really high numbers of flu, some of the highest numbers that we've seen in 5 to 8 years. Ideally, what that would mean is we will see flu early and then it taper off earlier as we go into the spring. However, at this point, we are not sure that that is what's going to happen. So the reminder once again is to get the flu shot to help prevent your infection. Thanks.
Okay, Benito did drop his question into the chat. We got part of it. So he was asking about RSV affecting children. If you could talk about how RSV is affecting children, what we're seeing nationally, what we're seeing in the county.
Yeah, so RSV right now, we are 9 times higher the number of cases that we've seen in the last 5 years. The country is 13 times higher. So what that means is there's a significant uptick in the number of cases that are being diagnosed. Now, remember, a large number of children that get RSV don't get diagnosed through laboratory testing. They get diagnosed based on their symptoms and going to see their primary care provider. About 35% of cases in the county are in the 1 to 4-year-old group, and in the 5 to 14-year-old group, a group where we see some RSV but not a lot normally, are about 16%. So what that means, vast majority of cases are in those that are young, a lot in the 1 to 4-year-olds, and we believe some of that is that age group did not have exposure to RSV over the last 2 years because of activities that were taken to decrease the transmission of COVID. At the current time, we are hoping that we are at the peak of RSV and we will start seeing a decrease in the cases. That is what we are seeing nationally, and our data from the last 7 days would indicate that we will have that same situation here. So it would be great news if one of these 3 diseases we've reached the peak of and we're starting to go down. Thanks.
All right, right now we have only Bud Foster queued up. If anybody else wants to get in line to ask a question, go ahead and use the raise hand feature, but we can go to Bud right now.
Yes, Dr. Cullen, I want to continue with the holiday theme a bit, if I might. We are in that season. If the stores are trying to entice a lot of people to come in to shop, and if you were going to shop for toys for the grandkids, or if you're going to go shopping for friends, how would you prepare yourself? What are the things to look for? And how dangerous might it be to go shopping right now in the stores?
Yeah. So shopping in a holiday season when we have high numbers of flu and COVID, it's a great question. We would encourage people to shop. We think shopping is important. We want to ensure that the economy stays robust. And we also want to know that you're able to get that special gift for your loved one if you shared gifts during the holiday season. What should you do to prepare? First, if you are ill, please don't go shop. Please stay home until you feel better. Perhaps you can shop online in that situation if that's an option for you. Remember to wash your hands and sanitize your hands. In addition, we would recommend that you wear a mask if you go shopping in a social situation indoors. Now, remember the mask you should wear is the one you will wear. We obviously know that the N95 is a better mask, but even if you're just wearing a surgical mask or a cloth mask, you are getting some protection. Finally, and this may be difficult to do, the crowds is what may put you at risk. So if it's possible, you may recall that 6-foot distance we recommended may be hard to do during active holiday shopping. Perhaps, however, stay 3 feet from the people in front of you. And consider shopping at hours of the day when the stores may be less busy. But we do want you to have a great holiday season. So there are ways, I think, to shop there are ways you can mitigate your risk and shop in stores as we move towards the holidays.
What if you're taking children with you to go shopping? What would you do in that circumstance?
Well, once again, we do recommend masks for anyone 2 and over. Below that, obviously, it's hard to do that. But I do think, once again, I think children can go shopping. Children can go see Santa or zoo lights or things like that if they want to do that. I would, once again, wash your hands, sanitize your hands, make sure you keep together with your family, right? Because remember, it's a family unit or an extended family unit if you have children with you. But once again, I do think it's safe to go do that, especially if you are not ill and you mask.
I also see that the morbidity rate nationwide is up pretty dramatically, like 65% over the last 2 weeks. 112 deaths in Arizona in the last week. So the morbidity rate is going up fairly substantially in our state. Any reason why you feel that might be, and what we might be able to do about that?
Yeah, this is a great question. I'll just share with you some specific data that we've been able to look at within the county. There was a 6-week period this fall where we had 60 deaths in the county. Of those 60 deaths, 55 were in individuals 65 and over, and the average age at death was 80. So that has pointed out to us the need to specifically target age as a risk factor. We have known age has always been a risk factor, but the data we are seeing now indicates that, once again, as we were early in the pandemic, age is the most important risk factor for significant morbidity and mortality. That is why we are concentrating our vaccine clinics right now on that age group. We have 4 vaccine clinics coming up in Green Valley. We are working with our geospatial people to identify other areas in town where there may be high numbers of people over 65 living, so we can get vaccine clinics in there. The other thing that I have not mentioned until right now is that there is an antiviral available, Paxlovid. You can get this for free through the county. You can be evaluated by the county to whether you are eligible for that. That medication is indicated for those 65 and over who are diagnosed with COVID. If that happens to you or a loved one or a family member, you can find out how to get what we call test to treat on our website. We know nationally there is an underutilization of this medication. This medication is still available free. So the county is offering testing through direct testing as well as at-home testing. If you test positive, even on a home test, you can do test to treat, which is a phone call. You do not need the internet access for that. You will be evaluated for whether you meet criteria. If you are over 65, you meet criteria. You will then have a prescription called into the pharmacy of your choice. At the pharmacy, it should be free because the federal government is supplying it. So what can you do? You can make sure you vaccinate. You can make sure if and when you test positive, you be evaluated for what we call an antiviral medication. Hopefully that will help protect this most high-risk group, which are those individuals 65 and over. Thanks. Long answer, Bud. Sorry.
No. Very important. Thank you very much. I really appreciate it.
All right, and you've taken us almost right to the top of the hour. We don't have any other questions right now. You might recall in the last press conference, Dr. Cullen said that we are doing home test kit distribution at all the county libraries. That wasn't true at the time, but it was a heck of a prediction because as a reminder, we are doing the home test kit distribution at every open library right now. So, and we do have one final question here. Hold on a sec. From Paula Rodriguez.
Hi there. I was wondering if you had any information about the availability of pediatric beds in the county with the higher rates and peaks of RSV.
We do, and thank you for that question. We do track pediatric bed availability. As you know, bed availability can change over an hour, over half an hour, but at the current time, all indications are that there is adequate pediatric bed availability in the county. The things that change that are transfers sometimes in from other facilities in rural Arizona. Most hospitals in rural Arizona do not keep their pediatric patients, so they do come to one of their urban settings, either in Pima County or in Maricopa. Right now, however, the pediatric bed situation does seem stable, which means there is adequate availability for hospitalization for pediatric patients. Thanks.
Thank you.
Okay. We don't have any other questions, so I think we can wrap it up there. If for the media, if you do want the recording of this, please leave your email in the chat if you haven't already. Other than that, any final words, Dr. Cullen?
We're coming up to 2 years of having vaccine availability for COVID. Our communication officer reminded me of that. I think what that means is it's been a long, hard road as we enter into 2023. So my words to you and to the community are, I hope people have a happy holiday and stay safe. And remember, there are things you can do to improve your health. And as a healthy community, we will continue to move through the current situation. So thanks, everybody. Bye.
All right, thanks all.
Thank you. Thank you and happy holiday.